What's your name?
Hans.
All right, I'm Haley. I'll be your athletic trainer today. How old are you?
I'm 20 years old.
Okay, and what sport do you play?
I play intramural water polo.
Oh, okay, that's nice. So what happened to cause the pain you're in right now?
I slipped on the pool deck and fell on my shoulder.
Oh, so you caught yourself with your hands, I'm assuming?
Kinda. I fell on my right side, my left hand caught, so it wasn't all the way on my right, but it hurt.
And it was on the hard pool surface.
Yes.
On the outside, is that concrete?
It's tile.
Tile, okay. So have you ever had this problem before?
No.
No, never any other shoulder injury?
I've been perfectly healthy up until this point.
Okay. What is your pain level on a scale of 1 to 10?
Right now it's sitting at about a 6.
A 6?
Yeah. And when it happened yesterday, it was at a 9.
At a 9 when it happened.
Mm-hmm.
Okay. Where's the pain exactly located?
It's right here.
Okay. And is it just in that area or does it spread out?
Well, right now it's just kind of in that area. If I try and move it or something, it will spread elsewhere. But
okay. Are there certain actions that upset it more than others?
Any shoulder movement.
Okay, gotcha. And so there's obviously weakness in the area. And
Yes.
Has anything been done to treat the pain so far?
I took some ibuprofen yesterday, and my roommate put an ice pack on me.
Did that seem to help?
A little bit. I mean, it hurt a lot, so only so much.
Okay, great. So for our observations, you can see that this whole shoulder is being depressed down, and so the clavicle is lower, the shoulder is lower, as well as the arm is being held by his leg at this point, but he's been supporting it while he's walking, I'm assuming. Can you get up and walk and show me how you hold your arm? All right, thank you.
It hurts.
So now we're going to move into special tests. We're going to do the piano key test to test for an AC sprain and the manual muscle test to compare it bilaterally. And so for the piano key test, I'm just So the patient is obviously in pain, and there's ligament laxity that is noted from pressing down on his clavicle. And then we're just going to compare some motions. So I'm going to have you press against on this side. I'll have you press against this. Very good. This way. Very good. And then we'll try this side. This side. All right. So obviously we're having a lot more weakness on the patient's right side. So first we're going to measure the range of motion, both active and passively, of the patient's uninjured left side. And so I'm going to have you move your arm back. So that's around 44 degrees, and then passively around 51 degrees. All right, now similarly, I'm going to have you move your arm forward. So that's around 57 degrees, and then passively around 62 degrees. Now we're going to measure the range of motion for flexion and extension of the uninjured side. So I'm going to have you raise your arm up as high as you can. All right, so that's around 158 degrees. I'm going to have you raise your arm up as much as you can. So that's about 37 degrees, and then passively is about 41 degrees. Now we're going to measure the patient's range of motion for abduction of the uninjured side. So I'm gonna have you try to raise your arm up above your head like you're doing a jumping jack. All right, and that is about 175 degrees, and then actively is around 178 degrees. All right, now we're going to measure the patient's flexion and abduction of their injured side. So I'm going to have you try and raise your arm up as high as you can. Great, that's about 11 degrees. And then passively is about 17 degrees. And then for abduction, I'm going to have you move your arm out to the side as much as you can. So that's around 5 degrees actively, and then passively is about 8 degrees. Now we're going to measure internal and external rotation of the injured side. So I'm going to have you bring your arm this way. That was good. That was around 12 degrees. And then passively is about 15. And now I'm going to have you move your arm to the other side. That's around 8 degrees, and then around 10 degrees passively. We're going to measure extension for the injured side. So we're just going to have him, we raise your arm up as high as you can. All right, that is about 9 degrees, and then raising it up passively is about 11 degrees. So for the first 1 to 3 weeks, depending on the patient's pain, given this patient's pain, it'll probably be more like 3 weeks. They're going to be in a sling and have immobilization of the shoulder joint, followed by Price protocol. So protection, rest, ice, compression, and elevation. So once the patient is out of the sling and can tolerate a little bit of movement, we're going to have them do isometric exercises such as internal rotation and external rotation. And these are going to be done bilaterally to ensure bilateral strength. The isometric contractions, the patient is going to do the following 3 exercises to strengthen the rotator cuff using the resistance band. And again, those are going to be done bilaterally to ensure bilateral strength.
Go.
All right, so now we're moving into the weight-bearing phase. So we're going to have him lean across the table and go from shifting weight from shoulder to shoulder. And then leaning forward and backwards. Great job.
Ow.
Go.
Once Hans is ready, we're going to move him into catching the ball with one hand because that's what he would be doing in his sport.